Hi everyone. Today I'm going to answer the question about sciatica. A lot of people have pain down the back of their leg. It's very, very common. And I just want to explain why that happens. Now, it's not exactly an easy answer, but it's one that I think we should all try to understand. Now, granted, there's lots of different ways that we could have pain in the back of our leg. We have typically pain in the back of the leg is called, in the back of our hip is called sciatica. Now there's different types of sciatica. The sciatica that's due to pinching of the nerve, which is probably the most common, most commonly perceived reason for having pain down the back of our leg. Whereas in reality, that's not the most common, far from it. So most of the common pain down the back of the leg we call a sciatic distribution of pain. So in other words, pain where your sciatic nerve is, but it's not necessarily because of something pinching your sciatic nerve. So it's important to understand the difference because they're very, very different causes and very, very different treatments. So we're just going to be looking at sciatic distribution of pain because it really is the bulk of these types of problems. So in other words, you have pain down the back of your leg. Why does that happen? Now, generally, the short answer is because there's tension on the back of your hip. That could be changing the blood flow to the nerve, or putting some pressure around the nerve, or you could just have some aggravation of that area of perception, but generally due to tension on the back of the leg. So we don't need to delve too deeply into exactly which mechanism, because the easiest way to understand it is it's just because there's tension on the back of our leg. Now, some people can, a lot of the sort of cures and things or ways of dealing with sciatica that you'll see on the internet are about trying to stretch the muscles on the back of our leg. Now, that could be positive and it could also be negative, or it could be nothing at all. So let me explain. The tension on the back of our hip is very often there for a reason. So this is what we call a compensatory tension. It's there because our body either puts it there for a reason to try to stabilize the hip, or your body loses the ability to control that muscle effectively. In other words, loses the ability to make that muscle relax. So it's kind of one of the two things, but very often they kind of relate to the same origin. So what I have to do in order to explain this is actually take you through a few different levels of what the problem could be. So again, pain in the back of the leg due to tension on the back of the hip. Tension on the back of the hip because your body can't turn that muscle off, or because it's turned that muscle on for a reason. So let's look at what that means. That's a compensatory tension, and basically your body is sensing that your hip isn't stable, so it's going to tighten up a muscle. Now, why would that happen? Now, that usually happens. You usually have hip instability associated with lumbar instability or low back instability. So when your low back isn't stable, you're going to end up with tension around your back to try to stabilize it. In other words, compensatory tension. And then if your back is unstable, you're going to end up with tension basically spreading into your lower legs. So some people will feel it in the back of their hip, some people the back of their knee, some people the bottom of their foot. But a lot of these tensions are happening because our bodies basically has sort of a cascade of tensions that are building as a result of instability in the back. So how do we fix it? That's always the obvious next answer. Well, fixing a lumbar instability is also not an easy answer. Yes, there are exercises you can do, some really, really great exercises. Swimming's a really good one. For some people, walking can be very, very good. You can do some directed things, but the problem with doing things that are very, very direct in the low back or even in the hip is that what you're doing in most of those things is trying to release that compensatory tension. But the compensatory tension is there for a reason. It's trying to stabilize an unstable joint. So when you take away that tension, you're also letting the joint move more, but it's also that joint's unstable. And that's not necessarily the best way to stabilize a joint. You don't let the joint feel unstable to stabilize. You have to work from a different angle. So unfortunately, it's not a really, really quick, easy answer to how to fix pain in the back of the leg. If you've tried all the stretches that you've seen on the internet and they don't work, it's probably because you have a lumbar instability. So that could be because you've had some trauma in your back, in which case it's worth seeking out some help with that. But at the same time, sometimes these instabilities in our spine can be addressed by other means. So walking is always a great way to do that. And I'm going to be doing some more videos specifically on how to stabilize our spine. But as a chiropractor and neurologist, one of the most effective ways of stabilizing the spine is actually fixing problems in the neck. So problems in the neck have a very, very large consequence on the part of our brain that turns on the stabilization system. So in other words, if there's a problem in the neck, we very often will have a problem with stability in the spine, not only stability of the neck, but everywhere in the spine, so potentially. So very often someone will come to me with pain in the back of the leg, or a lumbar instability, or hip instability, and we treat their neck to try to get their neck moving better and more stable, and get the balance of the muscles around their neck working better. And when they have better movement and better stability in their neck through the treatment, what it's going to do is stimulate the part of the brain that activates those stabilizing systems. And it's actually, you're going to find immediate stabilization of the low back and the hip. So this is really fun in practice because, if we assess someone and we're able to determine that the sciatic pain is due to tension in the back of the hip, and that tension is because your body's trying to stabilize it, because there's a lack of instability. If there's lack of instability in the hip, there's very often lack of instability in the lumbar spine. So if we've ascertained that both of those things are true, then very often what I will do is try to see if there's a problem in the neck, which could be compromising the stimulation of the system that stabilizes the spine. So if we can fix and resolve that problem in the neck, we can usually create an immediate stabilization of the spine, both the neck and the low back. And then we'll see that just by treating the neck, that the back is more stable. The muscles, those compensatory muscle tensions will melt away. The hip muscle tensions will melt away, and they can literally just get up off the table and have a loose hip, a loose back, or what I would say not loose because it's implying that it's too loose, but basically a muscle that isn't tight anymore. All those tight muscles melt away because they were compensating for the instability. So when you fix the instability by resolving these problems in the neck, which again is a great way to fix it, then we'll often just see that all the other things just melt away and people feel great straight away. This is really fun, particularly with cases where people have a lumbar instability, which has created some sort of a disc problem as well. So when people have a disc problem, it's because a joint is moving in a way it's not supposed to move, or it's been exposed to a very, very high degree of stress. So that could be because of internal stress of your body contracting muscles, particularly muscles out of balance. And it could also be due to a trauma as well. But anytime we're going to, if there's been a trauma and that's affected the stability of the back, and we can fix the stability via this neck functional system I was explaining, then you can actually help resolve those disc issues very, very quickly. So again, people can come in with a low back pain and low back problem and a very, very acutely painful back. We can treat their neck and they can get up and walk out without any back pain just by treating their neck. So this is a great way to determine when those things are in fact the reason for this. So anyway, I hope that answers some of your questions, and again, I'll do more videos on stabilization and how to resolve these things and things that you can do for yourself. So thanks again for watching.